Hello friends. Today we are going to discuss about role of psychedelics in treatment resistant depression. I am Dr. Suresh Bada, professor of psychiatry working at National Institute of Mental Health and Neurosciences, Bangalore. In this video, I'll be discussing about psychedelics, their role in treatment resistant depression, how they are classified, and in specifically I'll be focusing on psilocybin. What is the structure, how the psilocybin works, and also I'll be talking about psychedelics assisted psychotherapy, and finally whether the psilocybin should be used in treatment resistant depression will be discussed in this video. Let's understand about treatment resistant depression. We have more than 25 antidepressants, but the remission rate is one third. In spite of multiple antidepressant trial also, only one third continues to be remitted, one third will show partial improvement, and one third continues to be treatment resistant. This treatment resistance causes increased mortality, morbidity, poor quality of life, and also loss of job, invariably in turn to economic decline. Further, it impairs familial function, social function, and they will be invariably the burden on the family and also to the society at large. Hence, we need to have one or the other good treatment to address this treatment resistant depression, because the impact is not only on the patient but also on the community and at the nation at large because of the economic decline because of treatment resistant depression. So, how to define treatment resistant depression? This is a very enigma. The reason being is there is no consensus definition for treatment resistance. Keynes in 2019, along with his colleague, published an article titled as Defining Treatment Resistant Depression. And this is published in Depression Anxiety Journal. And in this article, he clearly said that there is no consensus among the researchers. Some of them used one antidepressant as a treatment resistant. Some of them said two. Some of them said three antidepressant. Some of them said four antidepressants. And few researchers said, yes, he needs to be treatment resistant even for ECT. Some of them discussed about psychotherapy. Hence, there was no consensus. And invention of various other treatments like vagus nerve stimulation, transcranial magnetic stimulation also added to the difficulty in defining treatment resistance. However, the European Research Consortium, like the Group for the Study of Resistant Depression, GRCD, clearly said that at least two failed trial of antidepressants in adequate dose and duration, either consecutively or in combination or in augmentation. If it is failed, then it is called as treatment resistant depression. Now we know what is treatment resistant depression for the purpose of study. And in spite of that, we have only one third of them remits because of medication. Still, we have one third partially improved, one third completely refractory for treatment resistance. In such a scenario, the novel treatment has to be found. And now the psychedelics are resurfacing back. Psychedelics are not the new treatment. They were there during 1960 and 1970. But invariably, because of United Nations and also United States of America started banning various mind-altering drugs. It can be cannabis, it can be ketamine, it can be LSD. And invariably, these psychedelics were not considered for even for research because there was a complete plan. And as you know, because of treatment resistant depression is picking up, hence the psychedelics are coming back. And they are considered as a novel treatment. Novel treatment refers to a therapeutic intervention that is new, innovative, and has not been previously utilized in standard medical practice. Of course, psychedelics was used not as a treatment for depression. Now it is coming for treatment resistant depression. Hence, it can be considered as a novel treatment. And it often involves an emerging technology, methods, or drugs that have been developed based on recent scientific advances. Although this is the definition for novel treatment, though psychedelics is there since at least for the past 5 to 6 decades for the purpose of treatment. But psychedelics have been used for spiritual purpose both in Central and South America, in India for cannabis. So invariably they are known for their mind altering and getting connected with spiritual some of these energies. But the treatment started only in 1940s and 50s. So understanding this as a novel treatment will be considered as not possible to meet the definition of novel treatment, but the reemergence of psychedelics can be considered. What is the term psychedelics? It means mind manifesting, or else you can call it as mind altering. But mind manifesting is the best word we can consider. These are those compounds that produce various psychological effects. Invariably, they are profound effect, which are characterized by altered state of perception, thoughts, feelings, and consciousness. They are called as psychedelics. At present, there is no consensus again. What are those drugs which fall into psychedelics? That means still the classification are very young. The newer drugs have been added. They are being found to be used in various culture, various religious practices. Hence, the classification is not yet finalized. Although I am going to give you a rough classification of psychedelics, some of them can be considered not to be included in the later part, or else the new molecules can be included here. I am considering the general classification of psychedelics. There are four different types of psychedelics have been considered. One is classic psychedelics, another one is atypical, the third one is amphotegens, and finally, dissociative anesthetic agents. So these are the four classifications. Let's take each one of them. The classical psychedelics are also considered as typical psychedelics, which specifically acts on 5-HT2A receptor. That is, agonism is occurring here, sometimes partial agonism. The various medications or drugs considered are tryptamines, that is psilocybin, ayahuasca comes here, ergolines, that is LSD, LSA. The third one is phenethylamines, that is mescaline comes here. These are classical serotonergic psychedelics. The second type is atypical. They are atypical because they do not act on serotonergic receptors. They are mucimol, salvinorin, and ibogaine and noribogaine comes here. The third type is amphotegens or enactogens. They are mixed serotonin and dopamine reuptake inhibitors and releasers. The classical example is MDMA, that is methamphetamine. And the final one is dissociative anesthetics. The classical example is ketamine. So these are the four different types of psychedelics have been classified. Some of the authors consider only two types, typical and atypical. Some of them consider four. So invariably, the classification and number of compound included in psychedelics, there is no consensus. Hence, this classification can vary between researchers and between textbooks. Now, let's understand the mechanism of action of psychedelics. Invariably, these psychedelics acts on the brain by altering neurohormonal modification. How does this neurohormonal hormonal modification occurs? It occurs through neuronal plasticity. It can be synaptic plasticity, receptor plasticity, hormonal plasticity, increasing the functional between the two synapses, decreasing the connections, and cognitive flexibility has been considered as the mechanism of action with regard to psychedelics in human beings. Now let's discuss directly with regard to psychedelics assisted psychotherapy. In simple word, it is called as PAP. The main feature is that therapeutic use of potent psychoanalytic substances in very few sessions. That means you do psychotherapy, and in few sessions you are going to use psychedelics. They are generally accompanied by drug-free session initially, later dosing of drug in a session, and finally there will be drug-free session by integration it is considered. So drug-free sessions initially, second one is integrated therapy, and finally drug-free session can be considered. So which are those molecules which are commonly used? The commonly studied psychedelics assisted psychotherapy are ketamine. Invariably 1 to 12 sessions can be considered here. Although it is still in the research with regard to psychedelic assisted psychotherapy, it either can be given as IV, IM, subcutaneous, intranasal, rarely oral. The second one commonly used is methamphetamine. It is usually 3 sessions, and with the drug, it is given orally commonly. Nowadays, the re-emerging drug is psilocybin. It is 1 to 2 session, oral drug is considered. The other two important LSD, 1 to 2 session again, oral is the common. IV and snorting has been also been considered as a street drug. Finally, ibogaine, 1 session orally. So, my dear friends, this psychedelics, as I mentioned earlier, not a new drug. They are all old drugs, and they are earlier considered in combining with psychotherapy. If you look at the psychedelics assisted psychotherapy, they are considered to be multidimensional in nature, and they have given a paradigm shift in psychiatric illness understanding. You can see in the middle of the circle a patient is undergoing psychedelic psychotherapy, during which they will be blindfolded and psychedelics are given. Invariably, psychedelics can be considered for therapeutic purpose. That means you are going to give drugs during the psychotherapy, and you're trying to find an explanation and also the reason behind the brain dysfunction. That means you are using both psychotherapy, psychedelic drugs, and also trying to understand the mechanism behind the illness and also the treatment. Hence, psychedelic assisted psychotherapy is considered as a paradigm shift in understanding psychiatric illness and giving medication. Now let's understand the molecular structure of very specifically psilocybin. Psilocybin, you can see on the right side, it is a prodrug. When it undergoes metabolism, it becomes psilocin. If you look at the psilocin, which is the active metabolite of psilocybin, and it is almost similar to serotonin. Hence, they act on 5-HT2A receptor. Hence, it is a classical psychedelics, and they specifically act on 5-HT2A agonist receptor. So, serotonin, similar to that, hence, psilocybin causes euphoria and various other effects. Similarly, MDMA, that is methamphetamine, also is similar to psilocybin. LSD and ketamine, you can see them, and also ayahuasca. Ayahuasca is again commonly used in Central America and South America. It is been used since many centuries. Invariably, it is the combination of two plant derivatives. DMT is the active ingredient and RMNA, and both these plants tea decoction is served during various religious and spiritual ceremonies. And they have been used since many centuries, my dear friends. But now it is emerging as a treatment for treatment resistant depression. As I mentioned, I'll be focusing on psilocybin. Again, psilocybin is extracted from mushroom and it is a plant alkaloid derived from tryptamine precursors and they are found in variety of mushroom species. Psilocybin can be extracted in 180 different types of mushrooms, my dear friends. It has been used by native people of Central and South America, as I mentioned with regard to ayahuasca and also this one. And it is sacramental context for centuries to facilitate ritual experiences has been considered with regard to psilocybin. There are various newspaper articles were written earlier and later it entered into academics. And in 1970, they were banned and now they are re-emerging for treatment-resistant depression. You can look at the psilocybin mushrooms, different types of species are there. As soon as the psychedelics mushroom is taken, within 20 minutes after ingestion, they can find the effects. And the effect reaches peak by 3 to 4 hours, and the effect wears out by 6 to 8 hours. Invariably, it is taken as oral intake. There are two types. One is drying the mushroom and using the complete mushroom 2 to 3 grams. Sometimes more than 5 grams is considered to be higher dosage to have higher effect. Now the synthetic psilocybin is used. 12 to 25 milligram can be considered. Whereas in street usage or in religious or spiritual practices, the dry powdered mushrooms are used in 2 to 5 grams. You can see the dried mushroom on one side and gelatin capsule where 10 milligram, 15 milligram and 25 milligram psilocybins are made available. What are the effects of psilocybin? As soon as the person takes psilocybin, at the end of 20 minutes, he is going to have certain effects. And by the end of 3 hours, there will be the peak effect. During the peak effect, he may have nausea, vomiting, muscle weakness, fatigue, relaxation, drowsiness, alteration in the blood pressure or increase in the blood pressure, increase in the heart rate. Some of them have headache, dizziness, and lack of coordination. These are the various physical effects. But the importance is psychedelic effect. What is the effect on our mental health? The person may have vivid visual and auditory hallucination, distorted sense of time. Invariably, even 1 second will be perceived as 1 year. That means this time completely slow down in using of psilocybin. Sometimes the time may fly, but invariably the people who use psilocybin, they say the time stopped for them for maybe 1 hour or 2 hours. That distorted sense of time is well known. Intense emotional response like euphoria, many a time introspection, what I am doing, what are my thoughts, what are my emotions, what is my behavior, that introspection occurs in psilocybin. Hence, it is considered for psychotherapy. A deep sense of connection to the nature or to the universe occurs here. That is the reason it is used by in spiritual practices and invariably connecting with God or higher spiritual powers. As I mentioned earlier, self-reflection and introspection is the reason for using of psilocybin. Altered perception of life, on life, and also synesthesia. Synesthesia is nothing but invariably music is heard, but here in synesthesia, music is seen. Colors are seen, but in synesthesia, colors are heard. So that altered perception is seen in psilocybin usage. What are the side effects? The possibility of abuse potential cannot be ruled out, especially in ketamine, LSD, amphetamine. Bad trips, especially in LSD, is very well known. Sometimes suicidal behavior, and invariably magic mushrooms, that is psilocybin, are not used in psychotic patients. it can trigger severe psychotic episode. Many a time, adulteration with psilocybin using fentanyl can cause death. Zombie-like pictures are well known when the psilocybin is mixed with fentanyl. Some poisonous mushrooms also looks like psilocybin. Ingestion can cause severe health problems and sometimes death. These poisonous mushrooms and also psilocybin look alike. Many a time, because of the grade, people sell this poisonous mushroom without their knowledge, thinking it is psilocybin, and this causes severe health hazards in public at large. And invariably, the effect of psilocybin is very, very unpredictable. The reason being, what is the type of species you are taking, what is the maturity of that mushroom, and also whether it is very well dried, whether it is mixed with any other drugs like fentanyl or benzodiazepine or methamphetamine. What is the personality of the person when he is taking? What is his expectation? In which surrounding he is taking this psilocybin also play a role. Further, the type of the mushroom, previous experience with these similar substances, combining with other drugs, all these causes different effect of psilocybin in different environment, in the same person, and in different mood state. Now let's enter into psilocybin therapy, that is psilocybin assisted psychotherapy. You can see there are three important phases of this psilocybin therapy. First is preparation phase. Second one is dose administration. That is, along with the dose, the therapy is done. And finally, the integration phase. Now let's look into the first preparation phase. First and the foremost, you need to know whether the person meets the criteria for treatment resistant depression and take consent. And you need to prepare the person for the psilocybin therapy. So, invariably, this lasts for 2 to 3 weeks. Once the consent is taken, and then you move into the dosing session. On the day of dosing, you bring them, the patient comes to the hospital, they are taken to the psilocybin room. Again, they are prepared, and the psilocybin medications are given, and they are kept for 8 to 10 hours in the hospital. And once the effect wears out, they are sent back to the home. And next day, they are invariably called for integration therapy so that their experiences, what they heard during the session with the medication, will be interpreted, and cognitive restructuring invariably can be considered if the introspection, the interpretation of their images, hallucinations can be considered here along with the therapist, and invariably it helps. And finally, you may have one or two more sessions, or else you can administer one or two more psilocybin therapy also. So, this is how psilocybin therapy is done. And invariably, it is given over a period of 3 to 6 weeks when you decide to give psilocybin therapy. Invariably, it is administered by a trained psychiatrist. The psychiatrist should be undergoing training with regard to managing both the set and the settings. The set means the mental state with which the participant enters into the experience. You need to know whether the patient has psychotic experience, is he using any other drugs, is he on any antidepressants, which can alter this effect. Hence, you need to manage the set, and the setting is physical environment in which the medicines are given. What is the supportive staff? What is the environment? What is the music chosen? This is forms the setting. So the set is the invariably the participant, setting is the environment. In the first screening phase, invariably you need to choose the patient who is treatment resistant depression. I would rather consider if the patient has not responded to 4 antidepressant, not responded to electroconvulsive therapy, then you need to consider psilocybin therapy. Again, it needs to be approved by the government in your country. If it is not approved, then be careful. You may be charged for some other reason for using these substances which are banned. Hence, considering your legal limits within your jurisdiction of the country or the state, practice using psilocybin psychotherapy. Initially, you need to do detailed evaluation, past history, personal history, medication history, substance use history, premorbid personality, mental status examination, and cognitive function has to be done. Please check what are the medications he has taken, how many antidepressant he has taken, whether he has psychotic depression or not, and also whether there was past history of suicide. So these detailed evaluation need to be documented in the file. And if you are doing any research, structured assessment can be considered. This is not must, but if you are doing a research, please do some of the diagnostic schedules such as mini, maybe even scan can be considered. So these diagnostic instruments will be used for the purpose to know whether the person has any comorbid medical condition. Use depression rating scale. If you are using it for PTSD scale. If you are using for JAD or any other drugs, any other illness, anxiety rating scale. And of course, global assessment of functioning scale, global clinical global improvement scale and severity scale, and finally the quality of life. Further, if the patient is elderly, please do consider using ECG, general physical examination, if required CT scan, and certain blood test, especially for LFT and RFT. You need to consider stopping certain antidepressant. If the patient is on monoamino oxidase, you need to stop it. If you give monoamino oxidase and psilocybin, the patient will have very bad reaction or else a bad trip. Hence, you may have to taper and stop antidepressant, especially the long-acting ones. Then only you have to consider psilocybin psychotherapy. However, there are various open-label trial, combination of escitalopram and psilocybin has been considered, and sometimes some patients have stopped medication and taken psilocybin, but you need to weigh the risk between stopping the antidepressant, suicidal attempts, or relapse of symptoms that need to be educated to the patient. Once the screening phase is over, the patient enters into preparatory phase. You need to discuss about the psilocybin therapy, what is the procedure, what are the other investigation has to be done. At the same time, here you are going to invite the patient to talk about his depression. What is his interpretation of depression? What is the reason he has got this depression? What he attributes for his depression? And how he wants to overcome this. And also you need to discuss about the possible effect of psilocybin. What are the psychological effects, mental effect? And also you need to take him to the psilocybin room therapy, show him the setting. You need to play certain musics and ask which music soothes him, and also blindfold him and show under what circumstances the drugs are given. And you need to review the consent again. This is preparatory phase, my dear friends. Once the preparatory phase is over, then appointment is given for dosing the psilocybin and psychotherapy. Invariably, the investigations are reviewed. The patients usually arrives at 8 a.m. in the morning. You need to you need to do urine drug screening. Many a time, the patient may be abusing many other drugs, street drugs. Hence, you need to do urine for drug screening, alcohol breath analyzer, and the baseline depression scales if you are doing research, and then review the consent again, and patient will be taken to the psilocybin dosing room. And invariably, this will be pre-decorated. That is, a room is with the low lighting and a psychotherapy kind of bed is placed. Patient is invited to relax on the bed, invariably in a supine position, and then a music is played through the stereo speaker or the earphones, and the patient is blindfolded. Here you can see in the picture the patient is sleeping in the supine position. Here he is using headphone to hear the music, blindfolded, and invariably the patient is asked to listen to the music and relax. And the patient will be listening to the pre-recorded playlist of music which are relaxing. And during the session, the therapist or the other people who have been trained will be with the patient for the remaining 6 to 8 hours during the session. Participants will be encouraged direct their attention inwards, basically for introspection. This is psilocybin therapy specifically. And during these 6 to 8 hours, BP, pulse, and respiratory rate will be monitored. Invariably, in between, the patients will be asked about the rating of intensity of the psilocybin effect. 0 being none, 4 being the highest effect. And you need to check in on the patients, asking how they are feeling, how much their time has felt, and also recording of the psychological effects, physiological effects need to be done during the psilocybin therapy. And invariably, the pulse BP monitoring is done at the 30 minutes, 60 minutes, 120, 180, 240, and 300 and 360 minutes. Invariably, every half an hour can be considered. Invariably, you need to keep oral lorazepam or IV lorazepam, or else even risperidone if the person is going to have a bad trip. They have to be ready. If the patient becomes highly violent, very disturbed, you need to abort the session by giving lorazepam. But however, the patient will go into deep sleep. That is how the sessions are aborted. Once the patient is stable and spends around 6 to 8 hours, then he is discharged from the hospital. It is invariably a day procedure for dosing session. This is again, you can see psilocybin psychotherapy, initial therapy, that is pre-psychedelic, psychedelic session, and post-psychedelic. Post-psychedelic session are considered as integration therapy. And invariably, the patients will be there for a psilocybin therapy between 3 to 8 weeks based upon the patient who is what medication is on, what is the washout period, whether they have given consent, and the waiting period which is available. And finally, once the session dosing day is over, the next day the patient will be called for integration phase. During this phase, the patient meets the therapist or the facilitator. They will discuss about the what are the experiences, what are the interpretation of these experiences, what is the insight he has developed, what are the emotions, why does he think about, and these will be interpreted and integrated into his personality. After this integration phase, you may have one or more two integration phases, and sometimes you can consider for optional dosing 1 more week, another dosing can be given. This is based upon the therapist and the patient comfort. Now let's understand what is the current international studies which talk about psilocybin therapy. One of the biggest study I'm going to discuss that was published in the New England Journal of Medicine. This is a study which is done by Goodwin and his colleagues, and Goodwin has written many articles on psilocybin, psychedelics. Please do read about them. The title of the study is Single Dose Psilocybin for Treatment Resistant Depression. So let's understand about this study. This was the first international multi-centered study on psilocybin. In this, a total of 233 patients who are treatment-resistant depressions were recruited. The trial employed double-blind study design. The participants were blindly randomized to the various dosage of psilocybin. It can be psilocybin 25 milligram, 10 milligram, and 1 milligram. And if you look at the results of the study, the arm with the 25 milligram of psilocybin showed significant improvement compared to 10 milligram and compared to 1 milligram. In all the three arms, the patient showed improvement. Significant improvement was in 25 milligram. Further, if you look at the psychedelics, other available studies like psilocybin, ayahuasca showed improvement in depression. But one needs to be aware whether these studies were in combination with antidepressant or else psychedelics alone, number of sessions of psychedelics given, what is the psychotherapy method approached here, when was this psychedelic stopped, when was the antidepressant was reintroduced, what is the measurement they used for the scales, what was the definition of treatment resistance, and what is the symptom improvement definition they used. These are the important things we need to understand, but unfortunately, most of the studies which are available are open label and they are very heterogeneous in nature. Various drug, various dosing, various type of psychotherapies has been used. But however, the dosing is usually considered as one dose or two doses which is 1 week apart is used. What are the challenges? The challenges of using psychedelics is because of various unanswered questions. Should we use psychedelics in a normal psychotherapy of 15 to 20 sessions, or else long term psychodynamic psychotherapy to be done, or else should we use CBT, DBT, or supportive therapy? What is that psychotherapy to be considered is one of the question mark. Should it be considered along with the long term psychotherapy is one of the question. What is the concomitant antidepressant should be considered, not to be considered? Number of dosage of psychedelics. What psychedelics? What is the dosage? Not been finalized till now. What is the long term effect? Is yet to be known. And finally, the abuse potential and the addiction potential need to be kept in mind with regard to psychedelics. But please remember, these are still in experimentation with regard to treatment resistance depression. Hence, you need to know what are the benefit and what are the side effects of psychedelics before you using. However, there has been a criticism regarding psychedelics being promoted by pharma industry because now many of these drugs like LSD, ketamine, psilocybin are marketed by some of the pharma industry. Hence, those studies are coming more. Since they are pumping into the market, there has been a criticism and availability of these street drugs of psychedelics by various spiritual and cultural places. And what is their potency, we do not know. And nowadays, the microdosing of psilocybin, LSD is coming in a major way with regard to creativity, productivity, mood altering, used by many public population, and it is used as an underground. And unfortunately, we do not know what is their effect and the long-term side effect of psychedelics, which we do not know, and what is the effect of psychedelics on on psychotic patient in long term. Does it worsen? Does it precipitates long-term delusions or long-term hallucination need to be known with regard to psychedelics. To conclude, my dear friends, treatment resistance depression is very high. 30% of the patients with depression have treatment resistance. There is a need for a newer medications and psychedelics have re-emerged. We need to consider these psychedelics very cautiously, but can be considered in treatment resistant depression. And invariably, they act both biologically and also psychologically because these medicines are given during psychotherapy. But however, further research is needed to confirm the efficacy to understand the mechanism and the long term effect of psychedelics. So, at this point of time, my dear friends, the preliminary evidence suggests some of these drugs are very helpful, especially ketamine and psilocybin in treatment resistant depression. However, the evidence for LSD, methamphetamine, DMT ayahuasca, the evidence is very minimal. But please remember, these medicines has to be given by a trained psychiatrist with a psychological support. That is, psychotherapy has to be performed in a controlled environment. And this gives the maximum effect and benefit to the patient. That is, you need to have a sessions before the psychedelics, 2 or 3 sessions, dosing session, that is with psychedelics, and finally integration phase. This is how the psychedelics are given, my dear friends. And in treatment resistant depression, yes, there are evidence are mounting up, but still it is in a research phase. So it's a open call for all researchers to consider psilocybin and various other psychedelics in treatment resistant depression research purpose at this point of time, not as a routine treatment for depression. So thank you very much for giving your valuable time. Stay safe.